What do seasoned medical doctors have to say to incoming doctors as they pass through their medical training? Well, Dr. Michael Klaper personifies that question. Dr. Klaper is a renowned physician who spent his years treating diseases that he felt were reversible or completely avoidable. But rather than impacting single patients at a time, he shifted gears and went directly to the medical schools to lecture incoming physicians on the virtue of food as medicine. Here is Dr. Klaper. Over the course of your many-decade career, I'm sure you've seen diet trends and fads come and go, and it's interesting to see what sticks and what doesn't and what passes. I'm sure you've seen it all. And right now, we're in a moment where we are seeing, the explosion of interest in plant-based diets and the science that backs it up. In lockstep with that, though, there's also a very, strident growing movement around low carb eating and the keto diet. And so I'm sure these questions come up all the time, especially with these students and just in general. So how do you kind of think about that, and how do you communicate around those other protocols, and what is your perspective on them?
Oh my, there's another show in itself.
We got time.
All right,
we got plenty of time.
Great.
So.
Okay, well, we'll go.
I mean, this is like, listen, there's a lot of
Key.
plant-based people that listen to the show, but there's people that are on different kinds of diets.
Yeah, absolutely.
And I think the reason I'm asking you this question is, for even a very well-educated, motivated listener or just consumer in general, they go online or they, read whatever's happening and they see the stuff about plant-based, but they also see the stuff about keto and low carb, and it's confusing. Even if you're, going to PubMed and reading abstracts, which almost no one does, it's still confusing, right? There's science to support different perspectives, and it's all very disorienting. And so I'm always trying to drive people towards, what is common sense here? Where, what do the facts really say? What does the science really say? And what are some principles that we can hang our hat on that can guide us in a trajectory that's doable in the context of our busy lives?
Very important, of course. So we'll put on our miner's cap here and drill down on this. Fair enough. And it starts with a recognition on everyone's part how toxic the standard Western diet has become. And if you're especially even dabbling in fast foods at all, every piece of meat you eat is going to be come with white bread and sugary ketchup and hydrogenated oils and the toxic load that comes with whether it's the pizzas or the burgers or the buffalo wings, etc. And all the diets who are serious about getting people healthier, whether it's paleo or keto or plant-based, whatever, all of us, we strip away that outer hull of toxic
we can
foods.
all agree that
we all agree
standard American diet, the fast food diet, is bad.
Indeed.
Yeah.
And once you do that step alone is a quantum leap, is a huge improvement, and you reduce a huge load of refined sugars and fats and foods that are grossly obesogenic. And as a result, people, and especially the paleo folks, strip out the dairy products as well, and as well as the oils. And when you take out the dairy, the oils, and junk flour products, people are going to lose weight. And the very act of losing weight does good things in most people's bodies.